Coming up, America's obsession with beauty.
I would get a boob job, thinner thighs, higher cheekbones.
Are we really becoming addicted to plastic surgery?
I think plastic surgery is habit-forming.
Two of America's best life changers answer your burning questions about the nip-tuck epidemic.
Are more men getting plastic surgery now?
That's coming up.
If I could change one thing about my face or body, it would actually be my teeth. Thinner thighs, higher cheekbones.
My ears, I just don't like the size or shape of them.
Getting crow's lines right here and lines right here.
I would probably want a bigger butt so I could fill out the jeans a little bit better.
I would get a boob job. I've wanted one forever, and let's be honest, boobs can never be perky enough.
Who might argue with that? Welcome to the United States of Addiction. You just saw how much people care about their looks. And of course, plastic surgery is an obsession that's on the rise. It's mind-boggling with role models like Heidi Montag out there getting over 10 surgeries in one particular marathon session. You have to wonder exactly where we're headed. It's an alarming topic and one I know you'll have many questions about. So we asked two of America's best life changers to come and weigh in.
Our first life changer, Beverly Hills plastic surgeon Dr. Garth Fisher, was recently selected as one of the top plastic surgeons in the U.S. for facial, cosmetic, and breast surgery. He's also a co-founder of Cellceuticals Skincare, Inc. Joining Dr. Fisher is clinical and forensic psychologist Dr. Catherine Selden. A consultant to over 150 shows, Dr. Selden's work has been showcased on ABC's Super Nanny, Extreme Makeover, The Bachelor, and The Bachelorette.
Dr. Selden, Dr. Fisher, thanks for being here. Dr. Fisher, as a plastic surgeon, do you share concerns about the perhaps overutilization of plastic surgery?
Oh, absolutely. Yeah. I share those concerns, and I try to protect my patients by educating them and really explaining the risks very carefully, and I turn a lot of patients down for surgery.
Well, this is a part of our program where our fans take control of the questions. Let's hear what they want to ask from us.
How do you determine when someone's unfit for plastic surgery?
The first thing is the expectations are key. Well, you know, expectations have to be realistic. I can basically predict what the outcome is going to be based on someone's expectation. It's that simple. When we do run into problems is when there's a serious body image issue at the center of the request, of the desire.
There's another question.
Physically, when does this person stop maturing to make it safe for surgery?
Dr. Fisher, what do you think?
I like to use the 18-year-old rule, and also they have to be able to be financially capable of dealing with complications if they happen.
Yep, is there another question?
Is plastic surgery addiction real?
That really goes to both of you.
I think plastic surgery is habit-forming for some people. There's a dissatisfaction. They get a high from the results. Usually, you know, the high could be short-lived, and then life goes back to where it was before, pretty mundane, with everyday problems, and there's a need for another fix.
You know why in my world why people get a lot of plastic surgery? Because they like the pain meds afterwards. I see that a lot. We've got some questions from our studio audience. Let's see. There you go. What do you got?
What is the most requested celebrity body part to get?
Depends on what year it is, you know, from Beyonce's lips to, you know, everybody wants to look like Brad Pitt, and if I could do that, I'd just go to work tomorrow and make 10 Brad Pitts and become an agent.
Wow. Are there body parts that they point at?
Oh, yeah, they'll bring in somebody's jawline, their cheeks, their nose, you know, different features of the face, and it changes depending on what's hot and what's not hot out there.
Do you discourage them from...
Yes, I think the best results with plastic surgery is when people come out looking like a better version of themselves.
Another question?
Are more men getting plastic surgery now?
I would say yes. More men are feeling more comfortable with just about everything.
Is there a particular procedure they're going for?
You know, liposuction, rhinoplasty, facelift, eyelid surgery, a lot of the things are there. Skincare, people are getting in, you know, men are you know, accepting this more.
I think I need a one.
You don't need anything. See, you're one that I would turn down.
We'll talk off the camera. Thank you guys for joining us, answering our questions.
Thank you.
We are going to be right back after this.